Hello everyone, thank you for joining me at my home here in Boxborough. I really want to thank all the folks at RCAP for this opportunity. This is something, testing my well, I've known I should do for a while, but I haven't done, and it's getting more and more important as we think about all the environmental changes. So I really appreciate this opportunity. And I want to thank the Health Foundation of Central Massachusetts for funding RCAP to bring this project to Boxborough. So thank you.
That's me. So, hello everybody. My name is Brian Scales. I'm the Executive Vice President at RCAP, and I'm also the Project Director for this very important project. And first, I'd just like to thank Dr. Mary for your warm invitation on this great day. We've waited a year for this, to be out with everybody to sort of kick this off, and I couldn't think of a nicer day or a nicer person to be with on this day. So thank you very much. I'd like to recognize our partners from the Health Foundation and everybody here. Dr. Jan Yost from the Health Foundation, a longtime partner with RCAP. I'd also like to introduce Karen Koller, the President and CEO of RCAP Solutions. Immaculate Mchome from Senator Eldridge's office, thank you for coming, and Dan from Dan Sena's office. So we'll get going. We're going to have a brief speaking portion to this. So first off, I would just like to introduce Dr. Jan Yost.
Thank you. When you hear of Flint, Michigan, what comes to your mind? No doubt it's the catastrophic failure of the city and the state to provide residents with safe drinking water. Flint was once a thriving city, the birthplace of General Motors and other industries that were allowed to contaminate Flint River. Then, when GM was struggling in the 1980s, many jobs were lost. Half of the city's population left, and 1 in 6 homes were abandoned. With the tax base eroded, Flint was operating with a deficit. And as a cost-saving measure, the decision was made to discontinue the 50-year practice of piping in clean water from Detroit. Instead, contaminated water was pumped out of the Flint River, while a new water pipeline from Lake Huron was being built. The corrosive Flint River water caused the aging pipes to leach lead into the homes. Elevated lead levels in the blood in Flint's children nearly doubled, and in some neighborhoods nearly tripled. Flint pediatrician Dr. Hannah Attila, who collected the evidence, emphasized, lead is one of the most damning things you can do to a child in their entire life course trajectory. Perhaps we can't imagine such a horrific development in this bucolic atmosphere of Boxborough, where families draw their water from a well, their private well. Perhaps some people think that God created earth and it came with clean water to be drawn from wells forever. Right? But Massachusetts, too, has its history of damage that mankind and industrial development has done to our environment. To protect the public health of our communities without municipal water systems, we have a responsibility to assure that private wells are a source of safe water. There are more than 90,000 private wells providing drinking water to residents in central Massachusetts. Rather than trust the well water is safe, we need to verify that it is. Thus, the Health Foundation of Central Massachusetts is pleased to support the effort led by RCAP Solutions to develop a private well program in partnership with local boards of health, the Mass Department of Environmental Protection, the Massachusetts Environmental Health Association, the Massachusetts Public Health Network, the Neshoba Associated Boards of Health, and others. The foundation provided $204,000 to pull the partners together in 2020 to plan this program. And for this year, we've awarded an additional $425,000 to pilot the program in 40 households. As the program further develops and is implemented over the next several years, We anticipate that the Commonwealth will establish regulations requiring routine testing of private well water and support a mechanism for remediation of contaminated private wells. We thank RCAP and its partners for taking on this project to assure our residents have access to clean, safe well water. Karen?
Thank you, Jan. Good afternoon, everybody. I'm Karen Koller, the President and CEO for RCAP Solutions. I can't say enough about the Flint, Michigan example because we had our own problems here in Boston, Massachusetts many years ago. We've had problems with the Mchome Valley river up here. And so there's been a lot of work going on with water and pollution management. However, the entree into well water and safe drinking water is unexpected. So I just want to give you a little bit of an overview of what RCAP is and how we ended up in the water business. So first of all, many of you may know us. We're about 53 years old now. We've been in this region as rural housing improvement since 1969. We used to be in Winchendon, we moved to Gardner, and then we went into Worcester, where we had the fortunate benefit of starting to work with the Health Foundation in addition to other partners there. However, we've been in the water business. It's been really, I probably shouldn't use the undercurrent word, but we've been underground. And many people like Jim Starbard, who is one of our technicians and state lead, we've been in this business since Jimmy Carter was president. Now, I'm going to tell you the story because many of you are way too young to know, but since the president is almost 100 years old, I think it's important to give him some testament to the work. He was such a visionary at the time. And because he came from rural Georgia, he ran on a ticket that he wanted to put a name and a label on how difficult it is to be rural. So, of course, he got elected, and then he goes into the White House, and now he's got to make good on his on everything he ran on. Sounds familiar, huh? So, so he calls people in, and this is honest to God true because my predecessor was at the meeting. He calls them in and he says, okay, what do we know about rural? So they ran a quick database. They found out that RHI, Rural Housing Improvement, was doing housing. So we were brought in for the first pilot program along with a number of other partners throughout the country who were already doing housing. So the assumption that they had was housing, that, you know, rural is technically poor, that you need to build homes for those people and help them assist. And when they actually did the demonstration project back in 1978, the group came back and said, no, Mr. President, it's not housing. You can put a house up anywhere, but if you don't have potable drinking water and then solid waste, then what you're doing is keeping rural poor because you need to bring infrastructure into their areas. So that's the story of how we started. $350,000. RCAP was one of the initiators. We had a pilot program here in Phillipston, way up in the boonies here. Templeton, you're from Templeton, you know that area. And so that's how we started. And slowly it has evolved. We have worked in Massachusetts since the beginning. We have worked, when I say we, it was probably many of Jim's predecessors, but we've been on Martha's Vineyard. We've been in the Berkshires. We've been in places where you don't think about the lack of water until you check into a bed and breakfast or you go to a hotel like in Flint, Michigan. You go somewhere where they have the nice little sign that says, please conserve your water. That's what it's all about. And so from there, we have worked in high season because New England, we're in the Caribbean, we have staff across the whole Northeast. And so we have worked in the infrastructure of water since the beginning of President Carter's administration. And we've been there for hurricanes. We have done all kinds of things. So we're here today in Boxborough, Massachusetts. I am just thrilled to death. And all I can do is say to you, Jan, first of all, Dr. Jan, Dr. Mary, I guess I better get my doctorate pretty soon. I don't know. But we are just so thrilled to have this partnership and this opportunity. And we really believe there is a huge future, especially in the legislative activity that Jan mentioned a few minutes ago. And so we are a partner to the legislation as well, to our elected officials. I hope that you see this as an entree to begin a strong conversation around how important water is and how, and you know, I always say to people, you know, we talk infrastructure. We've heard a lot about that on the administration side this year. So infrastructure, if it's above board, so they're fixing a lot of bridges. Drive out to Route 2, drive anywhere you want. A lot of rotaries are being reworked. That's all infrastructure. People don't worry about water until their water main breaks. And so, whether it is water in a rural community, well water, it is all a part of this whole underground system that needs to really be revisited, rebuilt. As you all, well, maybe some of you know, when they did Boston Harbor, those pipes were over 150 years old when they brought the new ones in. Something's got to change. So anyway, I'm going to stop. I think my 5 minutes are over. I can always talk forever. But I do want to thank you, Dr. Mary, for your wonderful hospitality, for letting us help you. And I hope that you are enjoying everything that's coming from your fresh drinking water. So that's it. So Jimmy, you next? I think so.
Afternoon, Jim Starbard, Massachusetts State Lead. Before I start, I just wanted to introduce Jim Garoffi. He's the director of the Mchome Associated Boards of Health.
Nice.
Brian wasn't able to introduce him when we began. So I'm just going to discuss quickly about how private wells are set up in Massachusetts and then go a little onto the well assessment program. Unlike public water systems that are regulated by Mass DEP and tested regularly by the water department, private wells are completely the responsibility of the homeowner. So, and if the homeowner is not aware of what to test for and how often to test for it, then, you know, it's overlooked and they just believe that the water is safe to drink. So part of this program is to try to standardize private well regulations throughout the state. Nowadays, there's 351 boards of health throughout the Commonwealth. Each is responsible for adopting and maintaining their own private well regulations. Massachusetts Department of Environmental Protection puts out a model regulation that the boards of health are encouraged to adopt and enforce, but unfortunately many do not go with the current standards and haven't looked into adopting them, more current standards, if you will. So hopefully at the end of this we'll be able to get a minimum standard like all other public health codes, the food code, the septic code, name it, that boards of health can be more stringent but not less stringent. So there'll be a minimum standard throughout the whole Commonwealth, like Karen just said, from the Berkshires to Cape Cod. The well assessment program itself is an educational and independent look at the well. Independent meaning that we don't have anything to sell you after the well assessment's done. We're going to make recommendations, but not who to go with, what kind of treatment to use, what kind of vendor to use. We're going to give you an independent look at the well, and without any, there's nothing in it for RCAP Solutions at the end. We're not going to sell you something at the end, as opposed to other contractors might be looking to sell you something when they make those recommendations. So prior to it, we look at all septic and well records that we can find through the state as well as the local board of health to get prepared for the assessment. Meet with the homeowner, ask a number of questions, and listen to the homeowner's concerns they might have with their well or septic system. Take the test then, which goes to the lab that day. Approximately 2 weeks after the assessment is done, a full report is sent to the homeowner with the sample results, anything we discussed, as well as any issues that might be found. We'll send informational tip sheets and other ways to remediate anything that might have been found. And we're available after, if the homeowner has any concerns after that final report comes in, if they have any questions or other follow-up that's needed in order to bring their water into compliance. But again, this is really about education for the homeowner, and hopefully get the word out to test you well and make the improvements as needed. So thank you everyone for coming, and I appreciate everyone's support.
Thank you, Jim. I also wanted to point out that this is the second year of this grant and our partnership with the Health Foundation, and we are starting in 2 towns. Obviously, the first is Boxborough, and Friday we're having a kickoff event in Hubbardston. And the important part of this is a collaboration with state legislators. And we have state legislators represented on our leadership board, and we have 2 representatives from that leadership board here today. And I'd like to invite Immaculate to come up first and give a few words, then Dan to follow her up. Thank you.
Good afternoon, everyone. I'm Immaculate Mchome, Legislative Aide and Environmental Policy Advisor for Senator Eldridge. The Senator could not be here today, but it is a pleasure and an honor to be here on his behalf. So to be honest, I did not know until this year that RCAP Solutions did programming for private wells. I was at a different webinar learning about the housing, and they mentioned wells. And I picked up my phone, I'm like, Michael, Chief of Staff, did you know RCAP does private wells? And it was just phenomenal to find that out. And more recently, learned about this program, and to know that somebody could buy their home and not know the quality of their water just amazed me. I could not believe that you could spend so much and then come home to a place where you think you're safe, you know, who does not look at the products before they purchase them, who does not look at food before they take it in. So somewhere that you think you're safe and the water that you're drinking could be harming you. To not know that and to not make that mandatory for families that have private wells, that's just not all right. So this is a phenomenal program, and so happy to be a part of it, to support where we can, whether it's on the legislative end or some other form. The Senator and I are here to support. It's important to get clean water to everybody, not just those that happen to get water from the public water system, but those that are getting private wells. It's important to get them clean water, keep them safe, keep the children safe. So looking forward to continuing this partnership. If you have not yet signed up to get your well water tested, reach out. It is so important, and it will significantly impact your life. Thank you.
Thank you.
Hi everyone, my name is Dan Szetela and I'm Representative Dan Sena's legislative aide. I'm really glad to be here today. I want to thank Dr. Mary Brolin for inviting us to your home to be here to kind of put a face to the name, as I would roughly say, to actually see the well, to see what we're working on, because we've been attending meetings talking about this but not actually able to see what a private well looks like on the ground. And also want to thank Brian Scales and RCAP for inviting Representative Sena to be a part of this program. And finally, of course, the legislative team, Senator Eldridge's office as well, who also is a legislator for Boxborough, because Representative Sena represents the 37th Middlesex District, which includes Boxborough as one of its 6 towns, and Congresswoman Trahan's office as well. So really, water is essential. Water is life. It is so critical. I mean, we're basically made of water. So this is a really important thing to make sure that water in private wells is safe, it's healthy, it's okay to drink, and to make sure that that testing is happening. Because at worst, it's peace of mind for the people who have the wells, and at best, I guess you could say, it's a real safety and public health concern. And I know that this is something that constituents of Representative Sena's have been really passionate about in messaging us. The environment has been one of the top issues they've messaged us about. We've got concerns about water quality. People really, in this district, really care about water, earth, air, the environment generally speaking, and so it's great to be involved in this project. I think, we're just really looking forward as the project moves on. We're glad that Boxborough is one of the first towns that's going to be going through this. We're looking forward to seeing the results that come up, and just how the legislature can interact with this, because I think it's really important that we have the legislature working together with the people who do the on-the-ground testing work, who are really kind of helping to inform the legislators on what the needs are in relation to current law and how we can make Massachusetts law better to ensure a healthy public, also to ensure consumer protection. As Immaculate mentioned, it's wild that you can buy a house and let's say the septic system has to be checked, but the private well does not have to be checked. And as somebody who really values consumer protection, who is on the Consumer Protection Committee for this session, Rep. Sena really believes this is an important aspect as well, both the public health and the consumer protection aspects. So we're just really looking forward to being the legislative partners in this work and making sure that people have healthy, safe wells to drink from. So thank you for organizing this today.
So I believe that concludes the, this speaking portion here today. I want to thank you all, and again reiterate thanking our host, Dr. Mary Brolin, for your graciousness here. Picking off these first two towns in Boxborough and Hubbardston, I think is going to go the first step to a long way in the future that we can all look back on this day and say how impactful it was. So thank you again so much. And thank everybody else for coming out on this nice day. Hopefully post-COVID we can start to have a few more of these. We've been waiting a year for this, and I think it was well worth it. Thank you very much.
Thank you, Brian.
For more information or to request a well assessment, please visit our website.